Hi, welcome back to this walkthrough of the MLA content map. Today we're going to be talking about ear, nose, and throat. Now, one thing I've noticed about this particular topic is that they've given you a very short list of conditions, when in actuality these presentations could show up in a number of different conditions, okay? So make sure you don't just stick to this list of conditions, you also do the cases where these presentations could show up that aren't listed here. So let's say you have painful ear. This could actually show up in the case of wax, right? Earwax could show up as painful ear and a bunch of other conditions, right? Here they've only written otitis externa, otitis media. You get the point. So make sure you know the DDs of painful ear, okay? Now, talking about acoustic neuroma, something that is very commonly tested in your multiple choice questions and your OSCE exams. Make sure you know the imaging you need to do in the case of acoustic neuroma. That's something that they love to hear or love to test you on. Another thing is benign paroxysmal positional vertigo. Make sure you know how to examine a patient with BPPV, because the Dixall-Pike maneuver and Epley's maneuver may be something that they ask you to perform or do in the patient, okay? Another thing, epiglottitis could be an emergency scenario in a child. You get stridor, right? Make sure you know how to diagnose and treat this condition. Epistaxis, something that shows up a lot, okay? And of course, just know how to counsel the patient here. You have in your presentations epistaxis. So learn how to advise the patient on conservative measures, leaning forward, pinching the nose, and then, of course, chemical and surgical methods of resolving this condition. So very common, do this well. Infectious mononucleosis, make sure you know how to take a history of infectious mononucleosis, how to pinpoint where the patient got the infectious mono, and what the patient needs to look out for, what you need to warn the patient about. Make sure you know that well. Okay, with infectious mononucleosis. Next, you have Meniere's disease, something that is very commonly tested, DVT, deafness, vertigo, tinnitus. And this reminds me, whenever you have an ear, nose, throat scenario, so you have Meniere's disease, you have acoustic neuroma, you have BPPV. So a lot of these conditions have dizziness or vertigo. So what you need to make sure is that you advise the patient on DVLA. So they need to inform the DVLA that they have this condition and they can't drive, okay? So make sure you don't miss DVLA in your OSCE stations. And they may actually ask you what you need to do about the DVLA in your MCQ questions as well. So yeah, just something that you need to look out for when it comes to ENT. Next, you have obstructive sleep apnea, something they very commonly test you on in your OSCE and your multiple choice questions. Of course, the patient will have snoring, and the patient will be sleepy. In this case as well, DVLA again, and referring the patient to the sleep clinic. So yeah, and maybe you'll have to advise the patient weight loss or a better diet because they might be obese, and tell them about CPAP or mandibular advancement devices. So just do this well, it does show up a lot. Next, you have otitis externa. Now, otitis media, otitis externa, all these different ear conditions. With ear, my tip is do it from the outside to the inside. So you have the external ear, right? You've got your external ear, and then going inwards, you have your middle ear, and then you have going even further inwards, you have your labyrinth, and you have your semicircular canals, right? So make sure you do all the relevant conditions at each level, and you know how to examine the patient for these different conditions, okay? Because they might actually ask you to perform an otoscopy with an otoscope on the patient, okay? So do that well, know all the examinations you need to do for your multiple choice question exams, and know how to perform the examinations in the case of your OSCE exams. Next, you have rhinosinusitis, also very commonly shows up. Hay fever shows up a lot, and then tonsillitis. So with tonsillitis, of course, you know, they love to test you on the criteria for tonsillectomy, usually in kids, and also when to give the patient antibiotics, right? So yeah, tonsillitis, very commonly tested, do it well. And like I said, all the different presentations, make sure you do the different DDs that could show up, right? So with allergies, you could have hay fever, you could, yeah, most of the time it's hay fever. You can have rhinosinusitis. You could also eventually get nasal polyps. So there might be, I think, nasal obstruction. You could actually get nasal polyp, and that's more of a recent scenario, and that isn't listed here. That's why I'm saying all the different DDs, make sure you do them well for all of these cases. So anosmia could be a neurological problem, could be some kind of nasal obstruction, could be a viral infection. You've got your cough, so upper respiratory tract infection. You've got your dizziness, right? You've got your BPPV, Meniere's disease, acoustic neuroma, right? Next, you have your ear and nasal discharge, your infections, right? Also, make sure you know about basal skull fractures. That could show up as ear discharge as well. Nasal discharge as well. You've got your epistaxis. That's very self-explanatory. You've got your facial pain. Could show up as Ramsay-Hunt syndrome. Okay, so that's very important in the case of ENT. Next, you have facial and periorbital swelling. Could be some kind of infection, right? Next, you have your hearing loss. Could be, again, wax, right? Could be acoustic neuroma. Could be, and yeah, that reminds me, Weber's and Riney's test, okay? So make sure you do those well as well. Make sure you know how to use a tuning fork. Next, you have your hoarseness and voice change. Could be hoarseness of voice after a thyroidectomy. Could be hoarseness of voice due to some other reason, so just make sure you do the DDs here as well. Nasal obstruction, nasal polyps, congestion, right? Next you have your neck lump, could be a thyroid problem, could just be lymphadenopathy, right? So make sure you examine the neck. So whenever you're doing a station of ear, nose, throat, verbalize that you're going to do an ear exam, a nose exam, and a throat exam together, okay? Whatever the condition is. So you've got your obstructive sleep apnea with snoring. You've got your sore throat with tonsillitis. Could also show up as pharyngitis. So yeah, that's how sore throat could show up. Could just show up as a teacher who's been talking a lot and has now developed hoarseness of voice or a sore throat, or the teacher has lost their voice. So you just advise rest. Next you have stridor. That could show up in your epiglottitis scenarios. Next you have your swallowing problems, right? Dysphagia could show up. Next you have your tinnitus, right? Also very important, could actually show up as just an isolated condition where the patient has tinnitus, and you have to advise what they can do to deal with this condition. You might have to offer counseling to them as well to figure out how to cope with the condition. Next you have vertigo. Of course, dizziness is a very big part of ear, nose, throat as well. So bottom line, make sure you do the DDs. When it comes to the presentations, this list is not as extensive as it should be, I feel. Okay? See you in the next video.